Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Papanos and Ramona Brennan.
Hello, everyone. Welcome back to the Nourish MD podcast. My name is Ramona Brennan. I'm one of your dietitians and hosts today, joined by my co-host, Papanos. We are so excited to be chatting about hair loss nutrition today, following our awesome interview with Dr. Fan, who is in dermatology. This is a kind of nice segue from talking about dermatology and skin health and how to preserve the best skin health possible, kind of an offshoot of that conversation as we talk about hair loss. Often the scalp skin is sort of neglected in that conversation, but it's very important. And there are a whole host of aspects of health that can impact hair loss. And so we're going to chat today about some common root causes of hair loss, how nutrient deficiencies play a role, etc. So hoping you enjoy this conversation. But Lauren, why don't we just kick it off by discussing the most common root causes of hair loss? What do you see to be some of those factors that can be involved here?
Yeah, and I think it's really important to distinguish that there are autoimmune conditions that cause hair loss, and there are also non-autoimmune conditions that can cause hair loss that are more like functional type issues. But really, all of these root causes that we're going to discuss can drive both. Now, when it comes to autoimmunity, we have to also take into account the immune system piece of it. So it can be a little bit more complex beyond just these root causes versus in non-autoimmune causes of hair loss. Really, once we've addressed these root causes, most individuals are going to see resolution of hair loss and improvement in hair growth. So it's important that you do see dermatology initially so that we can understand, is this an autoimmune type situation? Is it not? So that then we can support you the best in how to really resolve the hair loss and help with the hair regrowth process. And it's important to understand that there's 3 phases of the hair cycle. And so when I talk about hair loss and hair regrowth, right, those are technically different aspects. And most people are concerned about hair loss, but we also want to look at not just how quickly or how much hair you're losing, but also how quickly is your hair getting from the loss stage through the resting stage, through that growth stage, because that whole process can be about 3 months. And we want to try to accelerate it, right? So that we can get into that growth stage so that you can really see that healthy hair and hair regrowth happen. Now, there's a couple of different things that we see most commonly across the board. First and foremost, we want to look at the thyroid. The thyroid can cause hair loss because the thyroid drives all growth processes in the body, right? And we're talking about hair growth. The thyroid can stall that process, and we can actually have an issue present. We have thyroid hormone receptors in our hair follicles. And so if we're not able to get those thyroid hormones that our body is making into those receptors that are in our hair follicle, we're going to see issues present with hair loss and hair regrowth. And this is both in the situation of hypothyroidism and hyperthyroidism. Typically with hyperthyroidism, we see faster hair loss. And with hypothyroidism, we see slower hair regrowth, but they both ultimately are affecting this whole hair loss / growth cycle. We also commonly see issues presenting in the gut. We're going to talk a little bit further about this at the end of this episode, but this could be H. pylori. H. pylori is a very common infection with over 50% of the population estimated to have this infection. And H. pylori can cause hair loss because of its implications on stomach acidity and how well our body is able to absorb vitamins and nutrients from the foods that we eat. We can also see issues of fungal overgrowth causing hair loss. Oftentimes when we have fungal overgrowth in our gut, it also is happening in other microbiomes like our skin, our hair, our vaginal microbiome, because all of these microbiomes or these like homes of bacteria are all interconnected. And so this could be things like candida or other types of funguses that are causing issues with that hair loss. And if you've ever been to a derm for hair loss, maybe this is even something that they've explored, giving you a antifungal type shampoo. Dandruff, for example, is a very common hair issue that is related to too much fungal growth that's causing dandruff as a symptom. Nutrient deficiencies are also extremely common, and this could be because maybe we're not eating enough of these foods or because we're not absorbing these nutrients efficiently because of that low stomach acid type environment. And we're going to talk next about what these specific nutrient deficiencies are that most commonly are affecting the hair follicle. And then finally, I would say the most common is adrenal dysregulation. We know that elevations in stress hormones like cortisol can cause issues with your body getting through those 3 phases of that hair growth process. And so it can really keep your body in more of that hair loss stage and really delay the process of you getting over to that regrowth. And this is one of the reasons why acute infection can cause issues with hair loss. If you've ever been really sick, maybe it's been COVID or something of that sort, this can actually cause issues with hair loss, primarily through its impact that it has on the stress hormone production, and also the immune system's role, but also just chronic stress. Maybe you're not sleeping well, maybe you're going through a really stressful season in your life, maybe you're going through the menopausal transition. All of those things can be the cause that's leading to the hair loss and then that slowed regrowth. So Ramona, let's chat about, like I promised, those nutrient deficiencies. Of course, there's so many different nutrients that are important here, but let's just tackle maybe like the top 5 nutrients that we see in practice that are causing hair loss and hair regrowth issues for individuals.
Yeah, absolutely. And first and foremost, I think something that is very commonly touted as a hair growth supplement, so we'll tackle that one first, is biotin. And biotin is a B vitamin. We have a collection of B vitamins that are really important in the body, right? B1, 2, 3, we have a whole host of numbers of them. Biotin is often slightly lesser known unless it's in the context of hair growth, of course. So biotin is really important specifically for keratin production. Keratin is this primary protein that's responsible for hair growth. And that's kind of its main claim to fame in terms of healthy skin and healthy nails as well, because our nails are produced from keratin, our hair is produced from keratin. So without enough B vitamins such as biotin, our body doesn't have as much of that available in order to produce adequate keratin. So it's very important for that regard. Also, zinc. So thinking about vitamins as well as minerals in this context. And we talk about minerals very often, right? As kind of the spark plugs for those chemical reactions that happen in your body. Very important for metabolism, but also very important for hair growth. Zinc in particular is really important for the proliferation of hair cells. So when we're talking about those different stages of hair growth, for that hair regrowth, that proliferation and growth of cells, zinc is very, very important. Also helps ensure that the hair we are growing is strong. So not just that it does regrow, but that it regrows more healthy and more strong, of course. Now, another mineral that's very important is also iron. Iron deficiency in particular can contribute to hair loss. So, of course, making sure that we do have enough iron in order to prevent the loss so that we can then move into that hair regrowth. Very, very important. This also is really key from kind of a upper level, right? Iron's really important for red blood cell production and for circulation of red blood cells. So if we're not getting adequate circulation to our scalp, that's one way that can impact that hair growth. So iron is another very important mineral in addition to zinc. Now, another vitamin that is very important in addition to biotin is also vitamin D. We often talk about vitamin D in the context of bone health, but also super important for immune health. So thinking about that immune piece of things, whether you do have an autoimmune condition that might be impacting your hair growth or hair loss, or if you don't have an autoimmune condition, right? We still need to ensure that we do have adequate vitamin D levels in order to promote that healthy immune response. Because if your immune system is consistently activated, that can kind of trigger this hair loss because it can actively move your hair phase into that rest phase, into like kind of shunting off that regrowth phase. So it's kind of like everything gets frozen in a way, in terms of your hair growth. So supporting your body with vitamin D, in particularly to help nourish a healthy immune response, is really, really important. It's also noted, and granted in research, that we don't have a ton of reasoning as to why this happens, but it has been shown that the vitamin D, that adequate vitamin D levels is just important in general for maintaining homeostasis within those hair follicle cells. So just making sure that everything is stable and able to kind of be even keel there. So making sure that we're not vitamin D deficient, which is very easy to tell on a blood test, can help uncover if that might be one of these contributors to your hair loss. Now, fifth and final nutrient that we want to make sure we're not deficient in would also be omega-3 fatty acids. I've said it before, I will say it again. We talk about omega-3s all the time just because they are so, so important in the body. And when we talk about these fatty acids, these are essential fatty acids, meaning that we need to consume them through food sources, through supplementation. So having adequate omega-3s is really important for cell development and also maintaining cell structure. We need those fats in order to form phospholipid membranes, which is really key, like the gates around these cells. So making sure that we're nourishing cell health on a very microscopic level in order to support kind of general cellular functioning is really important for hair loss, hair health, and all of these things are things that we can supplement with and also get through food sources. All right, so now that we've talked about some of those nutrient deficiencies, Lauren, why don't we chat about how too much of certain nutrients can also be a cause or contributor to hair loss?
Just like with anything in life, right? Too much of a good thing can happen. And so we want to make sure that we strike this Goldilocks balance of having just the right amount and that we're absorbing all of these nutrients efficiently and not intaking too much. And so two of the most common nutrients I would say that cause hair loss that we see, one would be iron. I would say that's across the board the most prevalent cause of hair loss. And it could be because there's a genetic factor like hemochromatosis, or you might have hemochromatosis in the family, so you're more prone to iron overload that we call it. This can also be more common in men as well as postmenopausal women because there's no bleeding on a monthly basis happening like there would be in premenopausal women that are cycling each month. And so we do see iron buildup just happen more often within these populations. So this could be reflected within blood work that you've had. If you're looking at things like your total ferritin levels, which is your iron storage, you're looking at total iron binding concentration, TIBC. All of these can be variables that can tell us that there could be a situation of iron overload. And when iron overload happens, when there's too much iron in the body, it creates what we call oxidative stress. It's like this rust type situation that's happening on our cells. And that drives a lot of inflammation. And that inflammation can actually be what causes the hair loss to occur. So we always want to be looking at is, do we have enough iron to be able to support this hair loss and hair growth situation? And do we have not too much iron, right? Because both of those situations, too little and too much iron, can both cause hair loss. The other nutrient is vitamin A. Now, we're less concerned about excess vitamin A if you're getting it primarily through food sources. Primary sources of that are going to be things like your beef liver and egg yolks. That would be vitamin A in its most active, easily absorbable form. You also get vitamin A from orange vegetables that are rich in beta carotene, which are going to be things like bell peppers and sweet potatoes and carrots and such. However, the conversion over to vitamin A is not as great. And in about 50% of the population, they don't convert very much of that beta carotene over to vitamin A. So we're less concerned about those orange vegetables in excess and more so talking about synthetic vitamin A. So that's going to be vitamin A that comes in through supplementation. If you're eating vitamin A in its most natural form, there's less risk of toxicity because just like with anything, that nutrient, vitamin A, never occurs by itself in nature. It always has its other vitamin and mineral friends with it to help balance it, to make sure that it's not too much in the body. But when we supplement with things, and especially the synthetic forms that are man-made in a laboratory, they're not always able to make sure that they're well balanced with the other vitamins and minerals, and they get absorbed differently than does that food source of it. And just an example of this is that with vitamin A that you take as a supplement, it's not the exact same form as you take in food. In food, we're looking at retinol being the primary form. In supplementation, this is typically sourced as a retinol palmitate, which is a different type of compound. And so it acts differently in the body. But when vitamin A levels are too high, what can happen is it can push those hair follicles into that resting stage. We call it the telogen stage. And this can happen prematurely. So before it's supposed to be in the resting stage. So essentially we're getting out of that growth process quicker than we should. And this can then lead to excessive shedding. And so when we're talking about this conversation of hair loss, right, it can come in at many different places. Some people complain that I'm losing a lot of hair. It could be that you're having a lot of shedding, you're losing hair in clumps, or you're just not growing hair back as quickly as maybe you feel like you should or as you once did. We're talking about these excess of nutrients. We're really talking about vitamin A causing more hair shedding. And with iron, we typically see more blockage of hair regrowth. So not necessarily more hair loss, but just more so a slowed ability to regrow that hair that has been lost. So that is why it's important that we are getting in an adequate supply of these vitamins and minerals, but not too little and not too much of them.
Health challenges can feel overwhelming, but expert home care can bring peace of mind. With PPMA at Home, you get access to trusted professional caregivers who provide skilled nursing, therapy, wound care, and more, all in the comfort of your own home. Recover faster, feel supported, and stay connected to your physician and care team with 24/7 communication. PPMA at Home, because healing happens best when you're where you belong. Call today to learn more.
Now, I talked about initially that stress can be a big trigger for hair loss to occur. And so I want to get into a little bit about that, Ramona. So maybe you could talk to us about what is this connection between chronic stress, these glucocorticoid hormones like cortisol, and its relationship to hair loss.
Yeah, so piggybacking off of that iron conversation, right? Too high of iron causing this oxidative stress state. Another aspect of that oxidative stress is inflammation and nervous system activation as well. So when we talk about that nervous system being overactivated, we're thinking about the sympathetic nervous system state, right? That's this kind of fight or flight or freeze, as opposed to the parasympathetic nervous system state, which is more of that rest and digest. More of that tissue regeneration is going to happen when we're in that parasympathetic state. We're better able to digest our food because we're creating more digestive enzymes and stomach acid, etc. So we can either be in one of those two states. More often than not, we want to be in that parasympathetic. There are certainly times that it's appropriate to be in the sympathetic nervous system state, but when we get into trouble is when that sympathetic nervous system state is just where we are all the time. And that's where in those states, that's where we have higher levels of those glucocorticoids, that cortisol. So that's where we can also see chronically elevated cortisol levels kind of fueling us being specifically in that sympathetic nervous system state. And really when we're in that state, we might be producing more adrenaline, things of that sort. It's kind of that survival mode as opposed to that rest, regeneration, relaxation mode, if you will. So being in that chronic stressed state, as you can imagine, right, producing more of that cortisol, you're burning through more of those minerals. You're utilizing way more of those resources that your body could potentially use for other factors, right? And also your body is going to start shutting down these processes that are not essential for your survival, right? Whether you're a female of reproductive age, right? Maybe you notice that you don't have a period anymore. Maybe you're not ovulating, for example, right? Those technically aren't required processes in order for us to survive. Having hair on our head isn't necessarily an essential requirement in order for us to survive. Slowing down thyroid function, right? Preserving as much of the nutrients that we are intaking, slowing down metabolism as a result of that, is all part of your body's adaptive stress response in order to promote survival. So that high sympathetic activity leading to slower thyroid function can also be part of this root cause or contributor when it comes to chronic stress loads. But again, your body utilizing nutrients differently, metabolism slowing down, your body just kind of shifts how it utilizes energy, how it stores energy. And that nervous system state is also really closely tied together with how our immune system acts as well. So more of that elevated nervous system or active nervous system state can stimulate that immune system to promote inflammation, to promote these processes that are going to shift us kind of away from regrowth, regeneration, especially as it pertains to hair, right? So that's why you might notice more of that excessive shedding, less of that hair regrowth if we're constantly in this high nervous system activated state, that chronic stress response state there. So as we continue this conversation, Lauren, why don't we chat a little bit more about the role of blood sugar imbalances and insulin resistance in hair growth?
Yeah, so blood sugar is always going to be a common theme in any of our episodes because it affects so much within the body. But again, there's a role and connection that it plays in the hair growth process. And we see this both in men and women causing issues primarily with this hormone metabolite called DHT. DHT is a metabolite of testosterone, and it's about 3 times more potent than testosterone. And so when there is dysregulated blood sugar or there's this insulin resistance picture happening, it actually drives more of this testosterone getting converted over to DHT. And in men, that can cause male pattern baldness. And so you're going to lose hair on the top of your head, right? In women, we can see a similar situation happen, as well as abnormal hair growth happening in places it shouldn't be. So, for example, whiskers, chin hair growth, and things in more of the female population. And this occurs because DHT binds to these hair follicle receptors, and this leads to thinner and weaker hair. And eventually this can cause a condition called androgenic alopecia, which is a very common condition that happens in women that are postmenopausal, because postmenopausally, for some women, there can be higher levels of androgenic hormones like testosterone and these DHT hormones, because these hormones are made, testosterone primarily, can be made also by your adrenal glands. So even though you may not have ovaries anymore, or your ovaries might not be pumping out very many hormones at this point, your adrenal glands actually take over once you go through menopause. And these adrenal glands make a lot of these different types of androgens, testosterone being one, DHEA being another, androstenedione being another, and these can all present with issues of androgenic alopecia. So it all comes back to how blood sugar dysregulation, these high states of blood sugar, lead to increases in testosterone, to that DHT hormone, and how DHT then weakens that hair follicle and causes more of this hair shedding, hair loss, and thinning of the hair. So now that we touched on blood sugar, I want to get back into the conversation around the gut, Ramona. So let's dive into what is the relationship between the gut microbiome and hair loss. Maybe you can specify for us a little bit more what we're talking about when we mention things like H. pylori and fungal overgrowth.
Yeah. So first and foremost, really thinking about the microbiome, not only within our digestive system, but also our skin has its own microbiome. Scalp skin being included in that as well, right? We have these different microbiomes present among different tissues within our body. And there's a lot of crosstalk that happens between those different microbiomes. So just because you have digestive dysbiosis doesn't mean that that's not impacting your microbiomes in other parts of your body. And so when we think about some of these, when we think about gut dysbiosis as a whole, what does that mean? It just means imbalances, right? Maybe you do have high levels of H. pylori, maybe you do have fungal overgrowth, maybe that is specifically, for example, Candida albicans, which we see as one of those most predominant fungi that does overgrow in these different microbiomes. So the way that our gut microbiome impacts hair function, as you had mentioned before, right, that can absolutely impact how we're absorbing and digesting our nutrients. So when we think about H. pylori, oftentimes that's going to impact our stomach acid secretion. Maybe that's potentially bringing that lower. Usually we don't see too much stomach acid being the problem. Oftentimes it's too little stomach acid. And with H. pylori as well, and in terms of decreasing stomach acid, that's especially impacting how we're digesting proteins, how we're breaking down proteins, and the vitamins and minerals that we're able to get from those protein sources, specifically those B vitamins, as well as that iron, right, that we know is important in just the right amount. So there's a whole host of vitamins and minerals that are really important, of course, that we're getting through food sources. And we want to make sure that not only are we intaking adequate amounts, but that we're also digesting and absorbing that appropriately. So H. pylori, or specifically H. pylori overgrowth, because all of us have some level of H. pylori within our digestive system. It's not a bad thing to have it present. We just don't want it to be overgrown. But that can absolutely impact how we are specifically absorbing those nutrients, right? Fungal overgrowth is also very important because that can be fueled by and also contribute to fueling this insulin resistance, because it fuels off of sugar intake, and that's kind of its primary energy source. So we see a lot of overlap there between this blood sugar regulation and this fungal overgrowth. So kind of hand in hand in terms of how we want to make sure that we are addressing both of those pieces together, in terms of how do we then heal your gut microbiome, support your insulin resistance and or blood sugar dysregulation to support that. Of course, a lot of inflammation can start in the gut. Within our digestive system, we estimate that around 70 to 80% of your immune system is actually housed within your gut. So in terms of promoting that inflammatory response, a lot of those triggers can stem from within your gut. We've already talked about at length today just how much inflammation can trigger these issues with hair loss. So that chronic inflammation in particular can also specifically weaken your hair follicles and impact those different phases. And of course, if we don't have the nutrients that we need for optimal hair growth, that's also going to be a big piece of the hair regrowth aspect. So gut health cannot be overlooked when it comes to this hair loss conversation. Alrighty, Lauren, last but not least, what role does protein and amino acids play in hair growth, specifically thinking about lysine, collagen, etc.?
Yeah, I'm glad you brought it up because we talked about these key vitamins and minerals, but even just macronutrients like protein are so critical to this hair growth process. And the gut also plays a role here in our ability to absorb all of these amino acids. And we need adequate stomach acid, again, to be able to do that. So those two in particular, lysine and collagen, are just particular amino acids, which are the building blocks of protein. So think of it as like the subunit beneath protein of like, okay, well, what is protein made from? It's made from these amino acids. And two examples of those are lysine and collagen. Lysine helps with iron bioavailability. So we mentioned earlier the importance of iron for this hair loss and hair growth picture. And we know that lysine actually helps our body to be able to absorb and utilize iron more efficiently. So we want to make sure that we are intaking enough lysine to be able to help mobilize and utilize that iron. And then collagen. You might have heard of collagen being so great for everything from joints to your skin to your hair. Well, it's because collagen provides the amino acids that are needed for keratin synthesis. And that's going to be that lysine, hydroxyproline, and glycine that make up collagen. Collagen is the most abundant protein in the body. So we want to make sure that we are absolutely not in a deficit of it. And unfortunately, our body becomes more deficient in collagen as we get older. So we want to ensure that we're eating more to be able to combat that deficiency that's naturally occurring. But this collagen helps for this keratin synthesis as well as regeneration of our hair follicle. And there's even been studies that suggest that collagen helps reduce hair thinning and brittleness by helping increase the integrity of the hair shaft. So we don't want to just necessarily go out and supplement collagen peptides. We want to make sure that we are getting these amino acids from the foods that we are eating, that first and foremost, we're eating enough protein, throughout the day. Our protein needs do increase as we get older. A lot of times people think that they decrease because you have less muscle, but it's actually the opposite occurs with protein. So we're looking at about 0.8 grams per pound body weight as we're aging. So if you weigh 150 pounds, it's probably looking at about 125-ish grams of protein per day, optimally spread out between several meals that you're eating. So you're not just eating all of that protein at one sitting, but maybe we're aiming for around 30 to 48 grams of protein. So that's about like 4 to 6 ounces of meat each time that we're eating a meal. Or if you're plant-based, then we're aiming for a cup and a half or so of legumes when we're eating a meal to ensure that we're getting adequate protein and that we're getting a wide diversity of protein sources. That's what helps us ensure we get enough of these key amino acids like lysine, collagen, particularly protein sources that have the bone in them. When you cook something with the bone, you actually get more of this collagen production. So we're thinking about things like a whole chicken versus chicken breast, or bone in chicken thighs versus just chicken thighs without the bone. If you're eating a high quality red meat source, looking for those that have the bone in them, like a T-bone steak, a ribeye, for example. Or you can even consume bone broth. You can take the carcass of the meat that you've cooked or the bones, and you can steam them or simmer them over time with water, a little bit of acid, and maybe some vegetables and herbs for flavor. Or you can purchase pre-made bone broth and sip on that to ensure that we're getting some of these really hard to come by amino acids that are critical for the hair growth process. Yes, you can absolutely supplement with protein if you need to. You can use a high quality protein powder that has a good amount of these amino acids in it, or you can even use a collagen peptide powder. If you are going to supplement, we recommend that it does contain vitamin C with the collagen, or that you are adding in vitamin C through what you're eating, like citrus fruits, or through an additional supplement, because that does help with that collagen absorption. But that we're always starting first and foremost with trying to get in that diversity of those protein sources, getting enough protein, and primarily getting in those bone-in proteins before we look to supplementation to ensure that we're getting enough of these proteins. And then, as Ramona mentioned, ensuring that we're also absorbing enough of those proteins. And one little trick that can help with this is you can actually add in something acidic before you eat these protein sources to help your body absorb them further. So that could be adding in an ounce of apple cider vinegar into a couple ounces of water before your meal, squeezing in a whole lemon into a couple ounces of water. But we want to make sure it's just a little bit of water with some of that acid source, and that we're not then diluting that acid that we've worked so hard to increase by over consuming water during the meal. So just being really mindful to, only take small sips to the extent that you need them to be able to churn that food during the meal and not over dilute that stomach acid with excess water. So go out and get some of those bone-in proteins and make sure that you're hitting those protein goals.
Yes, I'm so glad that you added that aspect into it as well, Lauren. I hope that for anyone listening, they get some more insight if they are someone who's dealing with hair loss, just kind of some aspects to look for, right? Some areas to look a little bit deeper to hopefully get them to the root causes. But as always, if you would be so kind to like and subscribe to the show so that you are getting notifications for when we have new episodes. We do have episodes every 2 weeks. So looking forward to seeing you all again in just a few weeks. And if you'll be so kind to give the show a 5-star rating on your favorite podcast app, it really helps. So thanks so much for tuning in today, and we'll see you in a couple weeks.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.